article for this week is titled as An Evaluation of 1,654 Premolars Transplanted in the Posterior Region, a Retrospective Analysis of Survival, Success and Complications. It is done by Barendregt and colleagues. They are a group from Netherlands, and the paper it is published in Dental Traumatology Journal in April 2023. So premolars constitute the majority of transplanted teeth, followed by molars, canines, and incisors. The replacement of congenitally missing premolars, especially in the lower jaw with crowding on the opposing arch, is the most common indication for tooth transplantation. So the aim of this retrospective analysis was to evaluate the survival, success, and possible complications of transplanted premolars in the posterior region, subdivided by developmental stage and patient age. The population consisted of patients who were referred from various orthodontic, pediatric, and general practices to a clinic specializing in periodontology between April 2004 and December 2021. The stage of root development was radiographically evaluated using the rating of Morris. For the post-operative follow-up, the protocol used for avulsed teeth was applied, as the patients were reviewed at 3 and 6 weeks, then at 3, 6, and 12 months post-operatively. Thereafter, the patients were followed up at 12 months interval. The success of transplantation was evaluated using the following criteria: teeth with immature root formation showing a complete root formation following transplantation. Successful endodontic treatment was performed in immature teeth with bulbar necrosis after transplantation or in teeth with complete root development, and favorable periodontal healing with absence of deep pocket and normal tooth mobility. So a total of 1,654 premolars were transplanted, subdivided into 3 groups. The first group was immature roots, the second group mature in patients older than 18 years, and the third group mature roots in patients younger than 18 years. The average patient's age was 14.5 years, and the main indication for transplantation were agenesis followed by trauma. In all the 3 groups, the upper second premolar was the most commonly used donor tooth, and they had a total of 11 transplants were lost during the observation period. 4 transplants had to be removed within the first year, whereas the remaining 7 transplants survived between 1.5 and 7.5 years before extraction, with the progressive root resorption was the most common cause of transplant loss. Regarding the endodontic complications, were only observed in the immature group. Early complications defined as inflammatory root resorption were observed within the first 6 to 9 months post-transplantation, and most of the complications were observed in transplant with Morris stage 6 root development. When antibiotic prophylaxis was prescribed 1 hour before transplantation, as described by Andreessen, the percentage of complication in endodontic healing was reduced from 8.5% without antibiotic prophylaxis to 2% in cases of prophylactic use of antibiotics. The follow-up period was 10 years. After 1 year, a total of 1,066 transplants were available for analysis. After 3 years, around 350 transplants were available, and 14 only after 10 years. For the immature roots group, the overall survival and success rates after 10 years were 99.7 and 99.4 respectively. Regarding the second group, which was mature root in patients younger than 18 years, the survival rate after 10 years was 95.7%, and the success was 95.5%. For the third group, who were older than 18 years, the survival and the success percentage dropped to 83.3% after 10 years. So in conclusion, transplantation of premolars with developing and developed roots is predictable treatment modality, a strict treatment protocol to be followed to preserve the intact periodontal ligament around the donor tooth, which is a key factor for success, and the regular follow-up visits are necessary for timely diagnosis and management of complications that may jeopardize the survival and success.